Hi, I'm Sasakawa, a physiotherapist. I will explain how to cure lower back pain that doctors don't teach. Scientifically speaking, most lower back pain has an unknown cause. However, most people can be improved with proper rehabilitation. The reason why I can say that it can be cured, even the doctor doesn't know the reason, is the orthopedics usually check the bones to see abnormalities and make a diagnosis. However, lower back pain occurs even if there is no abnormality in the bones. The reason why lower back pain occurs without the abnormality in the bones is just because the muscles become stiff. If you take good care of the stiff muscles around the back, lower back pain will go away. So I hope you can learn from this video. I will explain the muscles related to lower back pain in particular. When you see from the front, there is a muscle attached to the base of the hip joint, like this. The muscle supports the front of the waist. Some muscles attach to the pelvis. This is the Iliopsoas muscle, which has become well known recently. This is the deep muscle, and it's an important muscle that supports the lower back. When you see from the side, there is a multifidus muscle in the deepest part of the back. There are the Iliopsoas muscle in the front and the multifidus muscle that supports it in the back. The most important thing for the lower back pain is that these two muscles are well balanced. As you can see in the skeletal model, the thorax has a lot of ribs that support the thorax. There are fewer people who have back pain compared to the lower back. However, when you look at the lower back, there is nothing next to it. It's not that there is nothing. There is an abdominal cavity below the thorax, and there are internal organs inside. The internal organs are covered with abdominal muscles. If I say abdominal muscles in a word, it's abstract. Among the abdominal muscles is the rectus abdominis, where you get a six-pack, and the abdominal oblique that supports diagonally in front. There is also a transverse abdominal muscle that supports everything like a corset. All of them are abdominal muscles, but the most important one is the transversus abdominis muscle that surrounds around here. When a transverse abdominal muscle, iliopsoas muscle, and multifidus muscle are stable, the lower back can be stable, so the muscles around here can be relaxed. If some muscles are weak, there are ribs here. It's the muscles from the ribs to the pelvis. When you have a lower back pain, you tap here, right? The stiff muscle is the quadratus lumborum. The quadratus lumborum and the rectus pinnae muscles, which are a little more inside, become very stiff. That is why when you try to move, your lower back hurts and you can't be in the same posture for a long time. If transverse abdominal muscle, multifidus muscle, and iliopsoas muscle work well, the lower back will be stable and the pain will be easily improved. For those who have a stiff waist, train the muscles here and it can make your body flexible. I will explain what to do at the end of this video. Don't miss it. Then, I will explain how to improve your lower back pain. First, lie down like this. Lie down and put your arm on your head, but please bend your knees slightly. Do not extend your knees like this. Relax with your knees bent slightly. From this position, put your elbows and raise your head. Look forward. If you look down like this, it works more on your abdominal oblique and the muscles in front rather than the transverse abdominal muscle. The transverse abdominal muscle feels power next to this, so do it while facing forward. In this position, turn your palms toward the ceiling. Do it clockwise, not counterclockwise. In this position, raise your body to touch the front of your knees. You are lowering your shoulders toward your feet. If you are lowering your shoulders, your obliques will tighten up. This oblique is the field that the transverse abdominal muscle is working. Lower your shoulders toward your feet. Do it like the shoulder blades and this pelvis are close together. Do it as your armpits and hips shrink. Ready, go! 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It looks easy, but it's pretty tough. It's better to put power as much as possible to improve the pain. One more time. Ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. One more time. Ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Let's do the other side. It may be easier to see from the other side. Lie like this and bend your knees slightly. Support your head and turn your palms toward the ceiling. Look forward if possible. Look forward and extend your hands towards your legs as much as possible. Do it as your armpits and hips shrink. When your armpits and hips shrink, your obliques will tighten up. This is the transverse abdominal muscle. Stretch your arms while turning your palms toward the ceiling. Your obliques will tighten up. Ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. One more time. Ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. One more time. Ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then your obliques will tighten up. Please take good care of yourself like this. Next, the Iliopsoas muscle that is attached from front of the waist. How to make it work is to align the soles of your feet well and separate your bottom and heels. Keep it about 6 centimeters apart. Align the soles of your feet and point your toes toward the ceiling. In this position, stand your waist up and put your belly button forward. When you put your belly button forward, this root will tighten up. It's also okay if you feel that this bottom is stretched. Stand your toes up and put your belly button forward. Keep putting your belly button forward for 10 seconds. Ready, go! 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. One more time. Ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. If you cannot do it because your hip joint is stiff, please put a cushion under your bottom to raise the height. Let's do this again. Stand your toes up and put your belly button forward. Ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is not stretching. We work the Iliopsoas muscle so it's more effective and you can put power. We work the multifidus muscle at last. The multifidus muscle is the deepest muscle behind this. It raises your hips. Lie down like this. Put both toes inside. Make sure not to close your knees inward. Put your toes inside and open your knees. In this position, keep both hips floating. Put both toes inside and knees open outwards. If it's difficult for you, you can use your elbows. Keep hips floating. Ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. If it's difficult for you, bend your knees, it will make it easier. Put your toes inside and knees open outwards, keep hips floating. Ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. By doing this, the Iliopsoas muscle in front of the hip joint, the transverse abdominal muscle that surrounds the stomach, and the multifidus muscle that supports the deepest part behind will work and the lower back pain will improve. I hope you will try it. If you like this video, please like and leave a comment. I am glad if you subscribe to my channel. If you know someone having trouble with lower back pain, I would like you to introduce this video. Thank you for watching the video.